Have you ever lived with somebody that snored and had a hard time falling asleep because of it? Most of us have, but many people overlook the real cause of the snoring: sleep apnea. Sleep apnea can develop as we get older and we don't even know it. This is why it is important to learn what it is and when you are young, like us, so we keep an eye out for any of the symptoms. First, let's talk about what sleep apnea really is. There are two different types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea, also called OSA, is the doctor's main concern because it is the most common. Research from the Mayo Clinic says obstructive sleep apnea is a disorder in which a person frequently stops breathing during his or her sleep. It results from an obstruction of the upper airway during sleep that occurs because of inadequate motor tone of the tongue and or the airway's dilator muscles. Sleep apnea causes some major health concerns that affect your body, and the most common symptom of sleep apnea is snoring. Although not everybody who snores has sleep apnea, snoring can mean something is blocking your airway and air is not properly getting through. Another huge symptom is fatigue. When you have sleep apnea, a lot of the times you will wake up feeling like you never slept. This disorder can also cause cardiovascular issues and even lead to stroke. Now that we know what sleep apnea is, let's talk about how we're going to prevent it from affecting our everyday life. Doctors and dentists are finally getting a grasp on how we can help this disease. Before, they would tell you to lose weight so that your neck isn't constricted, and now they have ways to help get air through your airway. CPAP machines are probably something that you've heard of but don't know what they are. CPAP stands for continuous positive airway pressure. This machine helps push air through a mask, which helps open up your airways and allows uninterrupted breathing. CPAP machines are recommended for the most severe cases. Dr. Kriegler says this to people who are reluctant to try this method. Many patients say that using CPAP has transformed their lives. Before treatment, many patients felt depressed and lethargic. After treatment, patients say that they feel younger and they have more energy and a better quality of life. They also see health benefits, such as improvement of blood pressure and blood glucose levels. Mouth appliances are more desired because they're a little less bulky, but they can only be used in less severe cases. Though an article from the U.S. National Library of Medicine states oral appliances are designed to improve upper airway configuration and prevent collapse through alternation of jaw and tongue position. The most common jaw mechanism of action is to hold the lower jaw in a more anterior position. In layman's terms, that means that they move your jaw forward so that your lower jaw isn't affecting your airway. In summary, sleep apnea is so dangerous and people don't even know how important knowing about it is. There are a few kinds of sleep apnea, and it is important to recognize when you have symptoms. Luckily, doctors and dentists have found a few different sleeping appliances that help you breathe better as you sleep. And now that we know about what sleep apnea is, we can be mindful about the people we care about and know when to talk to a dentist or a doctor.